COVID-19 is still expanding globally, but so is the scientific evidence base that helps us to better understand the virus, contain its spread, and minimize its impact on our health, our healthcare systems, and our economies. However, it is also becoming increasingly challenging for each of us to keep track of this rapidly expanding evidence base. This is where the COVID-19 Evidence Navigator comes into play. It has been designed to make this evidence base more accessible to you, to help you develop personalized evidence maps and to navigate them with ease. Here's a brief tutorial on how to use this tool. On the introduction screen, you'll be seeing, first of all, a graph that shows you the publication numbers per day over time. That is, how many articles are being published per day on COVID-19 and related terms in the PubMed database. This is followed by a brief introductory text where our team from RWTH Aachen University welcomes you and tells you a little bit about the COVID-19 Evidence Navigator. You'll then see a brief step-by-step guide on how to use it. There are two important steps to go through. First of all, you need to configure your evidence base. Second, you need to then navigate your evidence map. Let's go through these two steps together. To configure your evidence map, you need to work with that input area on the left side of your screen. The field updated shows you when we've last pulled the data from PubMed. The date range allows you to specify whether you want to cover the entire period up until today, or whether you want to restrict your analysis to a particular week or a particular day or a particular subset of this date range. Under discipline, you can either capture articles from all disciplines that are part of the PubMed database, or you can select one specific discipline, for instance, epidemiology. Under feature, you can then specify which parts of the respective articles you want to analyze as part of your evidence map. These can be the keywords that describe the core ideas of the paper. This can be the articles of the papers. This can be the abstracts, that is the summaries of the journal articles, or indeed it can be the countries, that is the location of the respective institution where the authors of the articles are based, which allows you to see also which countries are collaborating in that joint search for new evidence on COVID-19. Under journal quality, you can restrict your evidence map to journal articles that have been published in journals with a certain minimum quality as approximated by the SJR score or indeed the H-index. Under COVID-19 focus, you can then further restrict your evidence base to only select articles where the key terms from the search string, that is COVID-19 and related terms, appear at least a certain number of times. So these are essentially your parameters to configure the evidence map to your very own needs. For the purposes of illustration, I would now suggest that we examine all disciplines, look at the keywords, select articles from journals with an H-index, let's say, of more than 10, and focus on articles where COVID-19 related terms appear at least 5 times. Once we're done, we hit compute, and our personalized evidence map is now being created. This might take 1 or 2 minutes, and then we're able to explore this evidence map, that is to navigate our evidence map in 3 different ways, namely temporally, spatially, and on a network basis. And I want to explore with you each of these 3 views in turn. If we go to the temporal view, we essentially see the number of articles in your evidence base as they have been published over time. Plus, we're seeing which countries have contributed how much over time to the growth of your specified evidence base. That, in a nutshell, is what we're able to show in the temporal view. If we now move to spatial view, we see a map of our planet, and we see where the publication activity is really coming from. Obviously, as you would expect, a lot of research activity from China and also increasingly from the US. But most importantly, perhaps we're seeing that not only the virus has spread globally, but also the research on COVID-19 is now very much a global endeavor. Now, the final, but perhaps most important view for you is what we call the network view. The network view allows you to unpack the inner structure of the evidence that you're exploring. At the heart of the network view is what we call a co-occurrence network. A co-occurrence network essentially shows you three things. First of all, it shows you which terms are particularly frequently mentioned in the respective evidence. This is illustrated by bigger circles in this graph. Second, it shows you which of the terms are very central to this evidence base. These are then the keywords that are more in the middle of this network. And third, it shows you which keywords have been examined together in one and the same article. And this is illustrated by a line that connects the different dots. Now, to see really what's behind this, we need to zoom in to explore things a bit further. So the more we zoom in, the more we see really what the inner structure of this evidence base is. At the very heart of this network, we have the core keywords for COVID-19 research, right? Obviously, coronavirus, COVID-19, and so forth. The more we move to the periphery, the more we see more specialized topics, ranging from, for instance, themes of antibodies to issues of public health, issues of forecasting, of travel medicine, of pregnancy. So we are seeing then the richness of the evidence that is available to us. And the great thing is that this is an interactive feature in the sense that we can now click, for instance, on pregnancy to learn more about COVID-19 and pregnancy situations. And we then see which configurations of keywords have already been examined in the evidence that we've selected. And we can now zoom, obviously scroll down to see then the subset of articles that examines COVID-19 in pregnancy situations. So we see the first article, for instance, on sort of special attention to pregnant women and whether that should be, whether that is required or not. So you'll then not only see the list of articles, so here in our set, or in our context, we'll be seeing a total of 8 articles, but we can also click on the article link to then have full access to the full texts. So that in a nutshell was the introduction to our COVID-19 Evidence Navigator. Explore this to the fullest. It's a beta version, so please let us know your improvement ideas. Contact us simply through the feedback channel up here. Feel free to share any of your own outputs that you've generated via social media or in your own research. Many thanks for listening and enjoy working with the COVID-19 Evidence Navigator.